the system project, we discussed the lack of communication among Nova Scotia's health sector. Background. The Nova Scotia healthcare crisis did not just appear overnight. Despite their calls for help and proposals for solutions, the healthcare system has ignored the warnings of frontline workers. We explore the problems, solutions, gaps, and opportunities at the intersection of reliable technological communication tool with the health system. Research methods. We found 13 publications, collected 123 web interviews, conducted 3 personal interviews, and searched 30 websites. Problem landscape. Patient records are not shared or accessible by all necessary health sector parts. Therefore, tests, labs, and imaging are repeated, making the wait for those even longer. This is mostly because of the failures in the selection process for a supplier of the program, one person, one record. These wait lists consist of waiting to see family doctors and walk-in clinics, specialist appointments, labs, imaging and tests, results to be interpreted, surgeons, and operating rooms to be available. For the solution, the digitalization of health records, enhanced patient care, ease of workflow, lower healthcare costs, mobility, and big data and the cloud would help. Words of wisdom from Dr. Maria, a family physician. Clear, consistent, regular, honest, and respectful communication means the right person is making the appropriate decisions about care, and we have shared understanding about who is providing what supports. Gaps and levers of change. Funding. Nova Scotia's budget on the health sector. Training doctors on these new processes is time-consuming and costly. The money saved by having shared resources and systems in place should be put back into the system for patient care. If all the health professionals had access to the same information, miscommunication could be avoided completely. Creating a central database of information for patient files, doctor schedules, and waitlists, etc. will allow better understanding for faster flow of processing between all parties involved. Doctor collabs. Health professionals not having access to information. If all health professionals had access to the same information, miscommunication could be avoided completely, allowing better understanding, communication, and faster flow of processing between all parties. Medical professionals need to adapt to the new use of technology when it comes to the medical sector. With today's technology, there are endless possibilities of how patients can be seen by specialists from anywhere in the world. Technology and time. Nova Scotia not adapting to new practices, systems, or technology. Nova Scotia has several health data systems, but due to the lack of integration, there is an unnecessary repetition of exams requested by different professionals. Creating a central database will allow professionals to adapt to technology. Improvement in healthcare in Nova Scotia began more than 2 years ago when the decision to merge the province's 9 district health authorities into one body called the Nova Scotia Health Authority.